Hi there, Dr. Colón Rivera. How are you? Excellent session.
I'm not in Puerto Rico, so sorry about that.
That implementation failed. A great example
I'm
is
so jealous. Let me see, that might be me. Okay, very good. So you had so many good points. Where do I even start? One of them that you brought up was around social determinants of health. That's of course a very popular topic in amongst the healthcare scene, but specifically for this population, please tell us more how that relates to the patients you serve.
to Puerto Rico.
Sure. So my presentation is still
we have a
playing. Are we live?
We have a language different. We have a budget in different. Medicare.
We are live. I think maybe you gotta silence your video that maybe either you're playing in the background or somebody else.
Getting the same project.
Got it.
One state.
There you go. Now it's better. Okay, my bad. New on this. Okay. So what was the question? So social determinants and what we do as a mental health professional?
Yeah, how does that relate to the patients that you serve? Tell us more about that.
Sure. So I work for two nonprofit. I mean, one was founded in Puerto Rico, CreearConSalud.org, and one is the one I'm the medical director for here in Philadelphia. So, I mean, think about it. When we talk about social determinants of health, they're the determinants, right? They're running your life. We're talking about your job. We're talking about your education. We're talking about transportation, housing, where you live, where you grew up, who you are in terms of your environment, right? I mean, we talk about biogenetic versus environment, and sometimes it's like 50-50 versus 60-40%. So the environment makes you who you are, or half of you who you are. So when we talk about social determinants of health, we're talking about what define you. And of course, what define you makes you at risk or is protective against having a mental health or exacerbation. I mean, we know that when we remove a kid from a dysfunctional family, he can do better. Some of them do better in the foster homes. Some of them do not. So that's what determines who you are and where you move towards to. So we have a patient that they don't have a clinic close to their community, right? A mental health clinic. They will not seek help. What happened a week ago in Philadelphia, the riots, right? Because of what's going on with the Black Lives Matters, the movement, they destroyed some of the pharmacies. So now some of my patients, right? I mean, that's the part that people don't see. They cannot get medications because if they cannot walk to that pharmacy, they cannot walk to that clinic. That's all they have.
Wow. Thanks for that. So, what are some of the challenges, as it relates to training clinicians to be culturally competent?
Right. So it's really hard, right? We're not just talking. I mentioned that on my presentation. It's not only talking the language, right? It's also knowing the culture. I mean, we know that more African Americans and Hispanics are diagnosed with bipolar disorder or psychosis, right? Because the way we move, the way we talk, the way we act, we're usually happy people. So, I mean, and it has happened to me in the past. I mean, are you manic, Dr. Hector? I'm not. Nah, I'm always like this. So it is, and they're more medicated. I mean, they are. I mean, when we talk about African Americans or Black, I mean, Caucasian tend in an inpatient unit, they tend to over medicate them because they look bigger or they're louder. But I mean, that's just the bias, the unconscious bias that some of us have and grew up with, right? And Obama talked a lot about this when he used to walk around in his community, people was locking their cars before he was a president. So even Obama, he's not that muscular and big, but even Obama, just for the color of his skin, suffered that kind of bias that people had. So yes, there's data around that. There's data saying that African American Hispanics are more medicated and misdiagnosed with a psychotic or bipolar disorder. So of course, social determinant of health, even just the colorism, right, of your skin and racism and the unconscious bias dictate your treatment sometimes.
Yeah, that's one question I have about families and how do they have a role in the treatment you provide? Any considerations that you have in including them or not including them?
Right. So depends on the age, right? I think, and this every state has their own rule against adolescent and child psychiatry. In PA, for example, 14 and over, you can consent to get treatment without your parents. So 14 is an adolescent, right? I mean, adolescent definition by WHO is 11 and over. So even 14, right, can look for treatment without the consent of his parents. So, and also depending on the safety. I mean, is the patient safe to see a psychiatrist versus is a safety risk or substance use disorder or intoxicated? So if we take those apart, if you're not suicidal and you're not intoxicated or safety orders are not, family should be included. I mean, we need to get collateral. It's important. Also, it's not we spend 15 to half an hour to an hour with a patient, they go back home, right? We're talking about the people that support the patient is their family. And family, they don't have to be blood connected, right? We're people that raise you, grandma, foster parents, their neighbor, your girlfriend, boyfriend, and when we see patients from minorities areas, usually they're not with their parents, right? They were raised by grandma, grandpa, or by extended uncle, extended family. So it's really important to know, one, how the patient behave, not only when it's with you, but also when it's at home, at work, or in social environments to get a better picture. And I think, I mean, now that we're doing telehealth and using technology, we have been meeting the patient where they are since they're not coming to us. So we have seen a different perspective, different view of who they are because we are kind of matching. Right, we're going to their places without knocking the door sometimes because they just open the video and they're there in the kitchens and the rooms. So we're looking and we're seeing a different views of our patient, and I feel that gave us a little bit more of open our eyes and perspective.
Thanks for that. To close out here, we got about 2 minutes left. So when it comes to COVID, how's that impacted your patients?
Yeah, so great question, right? Nobody knew that it's gonna last this long, right? It's been hard for different perspective. I mean, when we talk about social determinants, again, things are being closed. We're now, I see a lot of kids, they're being forced or recommended to stay home, right? So summer camps, graduation have been affected, but also the lockdown, being inside for someone that is anxious, someone that has obsessive compulsions, someone that has depression. I mean, just ask someone like that to be locked down in their room when they're social human beings, they're social beings. That's one. Also asking parents that maybe didn't graduate from school to help their kids now. They have 4 or 5, I have patients with 8 kids, now they're doing homeschooling, they're doing school at home when their kids, when they don't understand what's going on in school. So they're kind of graduating themselves, right? Getting their GED again, because it's hard for them to help 8 kids. And forget about talking about the meals. Now we do need to make meals for all these kids, all the family, because we're talking they're not going to school, so 3 meals are not provided anymore. So if you have 8 kids, that's 24 meals a day. So just think about all those stressors, plus you cannot go to work, you don't have sick days, and probably your insurance have been affected. If you were working now, you don't have sick days, and you don't have insurance anymore, so there's no coverage. So you're afraid of losing your psychiatry, you're afraid of losing your PCP, or losing your medications that have made you stable until we are. Also meals, people tend to eat more or eat not that great, right? Because they're not cooking, they're not going to grocery, they're scared of going to places to buy food, so they're ordering from fast food, and diabetes go up, heart conditions, and you name it.
Thanks for that wonderful response.
Really incredible considerations all around, and I really encourage a lot of the attendees to inquire more about this topic. Please seek out Dr. Colón Rivera on the app, and thanks so much for joining us.
Thank you guys for having me.